think for me, the biggest, most horrible thing to deal with was the brain fog.
Brain fog.
Brain fog.
I really struggle with people's names, which I've never struggled with before.
I just tell people, you know, I'm sorry, I'm in an early induced menopause. I don't know the word to that, or I can't remember that, and you know, people are brilliant and they understand.
I lost my train of thought. I think that's it on that one.
Over a quarter of women going through early menopause due to cancer treatment experience hot flushes, memory problems, or brain fog. If you've clicked on this video, you might be going through it yourself or know somebody who is. I'm Bina, a Boots Macmillan information pharmacist, and in this video we're going to go through the signs and symptoms you might be experiencing, hear from other women who've experienced them too, and any tips on how to deal with these signs and symptoms. Got a specific sign or symptom in mind? Click in the description below to skip to that section. From a low sex drive to brain fog, you might have all the signs and symptoms or just some of them, ranging from mild to severe. Your signs and symptoms might be temporary, but in some cases they can be permanent. If you are unsure of whether the treatment you are receiving is likely to cause permanent menopause, speak to your doctor or healthcare team.
It's hard to talk to friends about it. I mean, vaginal dryness is not really something that you talk about on the school run. So I speak to people, but they find it difficult to understand if it's not something that they're going through.
The decline of estrogen causes the lining of the vagina to become drier and more delicate, leading to itching or soreness day to day. For some women, you may also find you have occasional bleeding or a brownish pink discharge. If you are experiencing these signs and symptoms and you're unsure where to start, you can speak to one of our Boots Macmillan information pharmacists, like myself, who can help you choose products to manage these signs and symptoms of early menopause. But there are a few at-home products you can try, for example, using a lubricant or vaginal moisturizer. These can be used daily or specifically when having sex. Try to avoid using any perfume products such as shower gels or bubble bath. Avoid petroleum jelly or products not designed for the vagina. Instead, use plain water or products which specify for intimate use. If you are still suffering after trying at-home remedies and switching your hygiene products, you should speak to your GP. During the menopause, the lowering of estrogen levels can weaken the muscles and tissues in the pelvic area. This weakening can result in urinary incontinence, leading to an involuntary leakage of urine in certain situations. There are two main types: stress incontinence, which can occur during activities that put pressure on the bladder, such as coughing, sneezing, laughing, or exercising, and urge incontinence, or known as overactive bladder, which involves a sudden and intense urge to wee, often followed by leakage. There are several treatments or lifestyle changes you can try to help manage these signs and symptoms. For example, pelvic floor exercises such as the Kegel exercise, avoiding foods that irritate the bladder like caffeine, alcohol, and spicy foods, staying hydrated, using discreet incontinence pads or pants, vaginal estrogen, which can also help vaginal dryness by restoring vaginal moisture and elasticity. But in special cases, medical or surgical procedures can be considered under the guidance of your doctor and healthcare team. If you have any further worries or notice any other changes, speak to one of our Boots Macmillan information pharmacists in store, or you can book a telephone appointment.
I think that was probably one of the biggest challenges for me. Was I felt really slow and really sluggish and not as sharp as I was, and I think that was a really big part of my personality that shifted, and that was a real challenge to get my head around.
Two key hormones, estrogen and testosterone, play an important role in cognition and memory. When their levels start to drop during menopause, you might experience brain fog. The cognitive cloudiness from brain fog can make it difficult to remember names, focus on tasks, and even find the right words during conversations. Our Boots Macmillan information pharmacists will be able to help you select products or suggest lifestyle changes that can help you support your well-being. Here are just a few examples. Fuel your brain by eating lots of fruits, vegetables, and fibrous foods like whole grains. It's also good to include dairy or dairy alternatives, different kinds of protein like beans, peas, and lentils, and healthy fats like olive or rapeseed oil in your meals. And get enough sleep. Sleep is incredibly important to help maintain our day-to-day function. A sign or symptom of menopause can be having difficulty sleeping. If you find yourself struggling with that, head to Boots Health Hub for lots of helpful advice, tricks and tips on getting good rest.
My fan goes everywhere with me for a hot flush. I feel like that's number one, keeps it under control. I've also had to buy a ball. It's a metal ball that you keep in the freezer and it stays cold all day in your bag. Anytime you have a hot flush, you can just rub it on your neck or somewhere and it will help cool you down. I would definitely say the hot flushes for me are my main thing that interferes from the early menopause.
One of the most spoken about signs for menopause is hot flush. But hot flushes are more than just feeling a bit warm. They are different for everyone. You may experience these sensations. A sudden feeling of heat, usually in your face, neck and chest. Red flushes or blotchiness in your skin. Sweating, dizziness, feeling cold after the heat has gone away. Changes in your mood and feelings of anxiety and reduced concentration. They can sometimes happen at night when they're known as night sweats, which can involve waking up drenched in sweat, needing to change nightwear or bedding. To help stay cool, you can try dressing in layers that you can remove and put back on easily, dressing in natural fabrics like linen and cotton, using fans, keeping your room cool at night, avoiding triggers like spicy foods, caffeine and alcohol, using a cool compress, taking cool or lukewarm showers, and exercising regularly. Some people even find that cognitive behavioral therapy, also known as CBT, can help to manage some of the physical signs and symptoms of menopause like hot flushes. Your doctor or healthcare team may be able to prescribe medicines that can help with hot flushes and night sweats if appropriate.
It affects your skin, your hair, your nails. You feel dry, brittle, like you're aging, and that has a huge effect on femininity.
Hormones are a huge factor when it comes to our skin and nails, and a drop in estrogen can lead to skin changes that you might not be expecting. These changes could be dry or itchy skin, sun-sensitive skin, breakout-prone skin, brittle or broken nails. There are a lot of cosmetic products that can help you with skin issues. Our Boots Macmillan beauty advisors in stores are there to recommend products that can help manage signs and symptoms. If you need advice about changes to your nails, our Boots Macmillan information pharmacists can give you some advice. But just like your skin, your nails also need moisture to keep them healthy. Lower estrogen levels can lead to dehydration and make your nails brittle and weak. Our pharmacists may recommend using moisturizer, rubbing it around and directly onto your nails. Always use it after washing and at bedtime. Protect your hands and nails by wearing gloves when doing household chores that involve detergents and cleaning fluids, but also wear them when it's cold outside. Look after your nails by keeping them short and filing them regularly to prevent them from splitting and breaking. During early menopause, hormones can significantly fluctuate. A reduction in estrogen, progesterone and testosterone can occur, and this might lead to an impact on bones, muscles and soft tissues of the body. This is why menopausal women might begin to experience more aches and pains. Each hormone plays a part in helping the skeletal system to function. Estrogen helps to nourish the tissues of the body, keeping them youthful and elastic. Progesterone supports feelings of natural calmness, helps to keep the mood stable, and increase pain threshold levels. Testosterone supports and increases bone density and helps to turn fat into muscle. There are several ways you can manage these signs and symptoms through exercise, hydration, relaxation, and several other lifestyle adjustments. You can find advice on our Boots Health Hub. Just visit boots.com/health hub and you'll find lots of free information under our Living Well section. If pain is interfering with your quality of life, speak to your doctor or your healthcare team for recommendations of treatments that will suit you during and after your cancer treatment. The cancer journey can impact people's mental well-being. Younger women hearing that as a result of their cancer treatment, they will go through early menopause can also affect their mental well-being. Those that are struggling with their journey should speak to their doctor or healthcare team. Menopause itself can also affect mental health, and some of the signs and symptoms may include anger and irritability, feelings of anxiety, forgetfulness, loss of self-esteem, loss of confidence, low mood and feelings of sadness, poor concentration, often described as brain fog and/or loss of words. If you or a loved one has cancer and are going through the early menopause, having someone to turn to when you need help can make a real difference. That's why Boots have trained over 2,500 Boots Macmillan information pharmacists who are specially trained to advise you on living with cancer and provide you support to you, carers, families, and friends. From explaining medication side effects to lifestyle changes or products that can help manage the signs and symptoms of menopause, Boots Macmillan information pharmacists will be available to help you. Find your nearest Boots Macmillan information pharmacist on our website or book a telephone appointment. Boots also have a dedicated information and resources hub about early menopause induced by cancer treatment on Boots Health Hub. You can access this by visiting boots.com/health hub. I hope you find this video helpful, and remember, you're not alone in this journey with early menopause induced by cancer treatment. For more information, check our Where to Start playlist link below or visit Boots Health Hub. Don't forget to subscribe to the Boots YouTube channel for more health and beauty advice.
My advice to somebody that's going through this is to push with your clinical team and talk to people like your GP, like your pharmacist, like your consultant, and ask them questions about it. Keep pushing for more information, do your own research, but do talk to people that are medically backed as well.